Do you need to hear about this this topic? And the answer is yes, you do need to hear about it. Why do you need to hear about it? Because now today you can think about it. If there are times when you have the possibility of being asked a question when you could be under great stress. On the other hand, you might not be under such great stress, but you get asked a question every time you go to get a driver's license. At least in the United States, and I suspect it's the same in Australia. That the last time I went to get my driver's license renewed, the lady was behind the desk, and I was up at the counter, and without looking up, she said, do you want to be an organ donor? And I said, no. Do you want to go on the computer board? And then she said, do you have a living will? And I said, no. And she went bump again. I don't know what she did. And then she said, do you want to donate $1 to the Second Chance Fund? And I said, I've taken a lot of exams in my life, and if the answer to the first two is no, the problem with the second one, the next third one would be no also. So I said no. Then I said to her, what is the Second Chance Fund? And she said, well, that's money that goes toward educating people like you as to why you ought to get organs. Now, I tell you what was going through my mind with doing that. I was thinking I came there to have my license renewed, and what they really ought to be interested in is to whether I can see and hear and drive. And they should not be interested in anything other than that. On the other hand, they take advantage of you. And a lot of, the large majority of people are answering those questions without knowing the reasons why they say yes or say no. By the time we get done here, I hope you'll have a little more information as to why you should say no. The other reason is that what's brain death all about? Brain death is about people who are like you and me right now. It's like we are right now, and then something happens. What happens to them? Something happens. They get in an accident, a motorcycle accident, an automobile accident, robbery, gunshot wound to the head. But whatever it is, a stroke, they end up in an intensive care unit, and they're on a ventilator. And their heart's beating, and they got blood pressure, and their color's normal, and their temperature is normal, and somebody comes along and shines a light in the eye, and there's no response to the pupil, and they put ice water in the ear, and the eye doesn't move. And they do about 5 of those basic tests, and then conclude that this person is brain dead, and that becomes the signal to have your organs cut out. And that's what brain death is all about. And it can happen to you or to me or to any one of us before the day's out. And you and your relatives very likely are not equipped to answer questions that you need to be able to answer. So that's what this is about. Now, I have slides. Actually, I'm often tempted to do this without slides. Because if you do it without slides, then we can communicate pretty well. Hopefully we can communicate with the slides. The slides are helpful, though, because what they do is make sure we touch a certain number of bases. And so we'll use the slides, but if they get in our way, we'll stop using them. What's on the slides to outline some things about the God-person relationship, some things about truth. God created the human person. Life on earth ends, and that's death. Is brain death equivalent to death? Is a question that needs to get answered. Some things about different words that we have to consider: person, life, soul, body, death, brain death, organ and tissue transplantation. And then what are the moral issues, and how did brain death happen? In brain-related criteria for death, the lack of scientific validity. Brain death is not based on any kind of science at all. It was just something that was devised, made up, concocted in order to get organs. The laws got involved quickly, and then a few conclusions, and then how all this fits into the culture of death. And then I put this Greek word euthanasia. In some ways it's a distraction right there, but let's at least look at it since it's on the board. The word that you're used to seeing is euthanasia, euthanasia, but that's the incorrect word. EU means good, and euthanasia means death. And so we're all opposed to euthanasia, yet if we translate it, we end up being opposed to good death. You know, and so it's a mix-up of words. They do it to us all the time, and so you have to get the correct word. The correct word is euthanasia. Epi, E-P-I, from the outside. Valo means to throw or to thrust upon, and then euthanasia means death. And so that Greek word is imposed death. Imposed death on the unborn is abortion. Imposed death on a newborn is infanticide. Imposed death on an adult, they call it physician-assisted suicide. Nonsense. It's all imposed death. So what are we opposed to? We are opposed to imposed death. What are we for? We're for life. We're for God. That's what we're for. Now, God creates us, and each of us is special, unique, irrepeatable. And there's a special relationship between our God, between our Creator and each and every one of us. God creates us male or female, and that's how we start out. We start out with creation. We're already male or female. We don't become, when God creates us, we don't become male or female because of the sperm. That's not what makes us male or female. We're made male or female. That's how God makes us. And then conception. What is conception? Conception is that the manifestation that life on earth has begun. Life on earth has begun. And only the word conception is proper for the human person, for the human being. The word fertilization is not proper for human beings. That has to do with bees and pollens and beasts and cattle, chickens, whatever else it is. But it's not the proper word for the human person. The conception is the proper word for that. Now, God creates the person. God concreates the soul, the intellect, and the will. The human person is individual, one, substance, of a nature, rational. We learn about God from the Bible. We learn about God from things that God has made. And the special creature is the person. The person, attributes of God that we have. We have our existence, conservance. We have to take care of things. Concurrence. We can't do anything unless God concurs. And then governance. We have control. Control in a rational way. At least that's what we should have. Individual, substance of a nature, rational. That definition is around for a long time. It's by Boethius in the year about 450. He had it in a little bit different order, Noxere Rationalis, but in this order it makes it a little easier for us to read. Individual has to do with our existence. The substance has to do with how we're made to the image of God. The nature is made, how we're made to the likeness of God. And rational has to do with governance. It manifests the attributes of man by his reasoning to make the future of good works a reality. The soul contains the body. The soul is whole and entire in the whole, and whole and entire in each part. Life manifests the soul body presence. Actually, you can interchange soul and life. When life is there, the soul is there. When the soul is there, life is there. The life manifests the soul body presence. Life on earth is like a line that you can draw. It has its beginning, it's continuous. Eventually life on earth ends. Our life continues, but our life on earth ends, and that's called death. The first manifestation of our life is at conception. Remember, God creates us as persons. And then at conception, as Pope John Paul II writes so beautifully, the first 10 years of his papacy, he wrote many things. It's put together in the Theology of the Body, there's another book called The Unity of Man and Woman. But the first 10 years, many writings, I encourage you to read them, to study them. But Pope John Paul uses, at conception is when the invisible becomes visible. Not with our eyes, but that, we got tricked in the pro-life movement because we used to say that all medical and scientific facts indicate that a new human life begins at conception. And then, because of some other things, they try to do things to us to put in words like pre-embryo and make things about implantation and all that. And so then we switched. And we started to say that all medical and scientific facts indicate that human life begins at fertilization. That's wrong. That's the wrong word. It does not apply to human beings. What happens at conception, all medical and scientific facts indicates that a new human life has begun. Has begun. We can know it at conception. That's what the word means, and that happens. And the only place it's since Adam and Eve has been within the body of our mother. Life on earth ends when there's separation of the soul and the body. What's left on earth is a corpse, the remains. A word to describe it is empty. The remains, medically and biologically, can be described in terms of dissolution, destruction, disintegration, or putrefaction. There's truth. We sometimes have to search for the truth, and there is truth. Truth never changes. Once you find the truth, it stays the same. God never changes. God's always the same. People try to say, well, things change. No. God never changes. Truth never changes. And sometimes it's a little difficult to find. Not really. The difficulty comes because we get misled. And then when we get misled, how do we back up and go back and maybe start again? The relationship between the physician and the patient depends on a standard of intrinsic worth for the patient, also for the physician. What can the physician do? The physician can protect life, preserve life, and prolong life, and postpone death. These are very, very important words. I encourage you to remember them. You see them. You'll see these words throughout the Bible. You stay alert. You'll see them. They come up all the time. Protect, preserve, and prolong life. And that's what a doctor does. A doctor takes care of life. A doctor doesn't do death except to postpone death. Postpone death, and the other thing that the doctor has the responsibility is for declaring that someone is dead. But the doctor can only declare death after it has occurred. There's another part of medicine that's over here, but I don't really want you to pay too much attention to it because we want to stay on the side of truth. Now, the standard of intrinsic worth when it comes to somebody who has the potential of being declared brain dead, that person has an injury or disease of the brain and presents in an emergency room, in an intensive care unit. What can the doctor do? The doctor can protect the life, preserve the life, prolong the life, and postpone death. That's all. That's all. That's all we have anything to do with. The physician must not kill and must not do harm. Now, the unconscious person in the intensive care unit on a ventilator with absence of some tested brain functions, but many other signs of life, is living. Brain death was devised to get organs. A few days ago, I debated a transplant surgeon, and he pointed out that Dr. Byrne wasn't correct when he said devised to get organs. It was also devised to stop ventilators. To stop ventilators. So to get people off ventilators quickly. And it was. You can look in the German American Medical Association. The reason that they had to have this new way to declare somebody dead was because they wanted to get organs, especially hearts. They also said intensive care units were getting crowded, and so we had to move them on some way or another. So find a way to declare them dead, and that's what they did. And he was correct. There were two ways. Usually I don't bring in the other way because in some ways it's not important, but you know, it is important. It is important because people, because of brain death, are not getting a fair chance. And even if they aren't going to get your organs, because of whatever reason it is, they're going to get you dead more quickly than you would be otherwise. Now, in brain death, the person is said to be brain dead, but alive enough to get organs. A part of the whole brain is not functioning. The death, though, is manifested by biological signs, or at least lack of them, and it's more than non-function or even destruction of more than one organ. Death is more than just an absence of function, and it's more than just even destruction of one organ. You know, that once death is there, that's when the soul leaves the body. What's there is that more than just absence of functioning, but it's manifest in terms of destruction, dissolution, disintegration, putrefaction. Death is something that we can know. Now, the physician and the brain dead patient, what it is, a brain dead patient, this person, his patient is now said to be brain dead. Joe is not with us anymore, they'll say. And then they say, Joe's body is still alive. And then conveniently or inconveniently, but stubbornly alive. Legally, a cadaver. Biologically and morally speaking, not a cadaver. The person is alive with a beating heart, blood pressure, and many other organs and systems. The moral issues are, is this person in fact dead? And the next part of it that fits right in there is, may a healthy heart or other organs be excised? The corpse, to compare corpse, the corpse of the dead body remains. Now, empty is a good word to describe the corpse. Disintegration, dissolution, destruction, decomposition, separation. These are words that apply to death. It's more than an absence of function. Functions are functioning. Why do I put this in here? Because the laws in all the countries, except for one of the Scandinavian countries, I believe it's Norway, I don't think it's Sweden, but one of those Scandinavian countries calls for destruction of the entire brain. That's the only one. Now, every other law, including the law in Australia, assuming that the book that I have is up to date, they call absence of function, functions are functioning is what they call for. Now, it took me a fair amount of time to understand what was going on, because in some articles, in the same paragraph, they will interchange an absence of function with an absence of functions, with an absence of functioning, with destruction. They interchange them. Well, look what happens. When someone is dead, there is destruction of certainly the brain and other things also. And if you come back, there is absence of functioning. And yes, it won't come back because someone's dead. You go the other way, though, and you observe an absence of the functioning, and that's what you observe. And then if someone wants to say, well, it's an absence of the function, or the functions, and there's lots of functions of the brain, there is no such thing as any one function, although some laws are written with a single S, and the like. Well, once you understand it, you can, and the mind plays tricks on us. The mind lets us do this, and for the most part, we don't have to be so disciplined, but we better in the Respect for Life movement. And so remember that all of the laws revolve around an absence of function, functioning, or function. Now, before 1968, there wasn't a lot of difficulty at declaration of death. Someone, for whatever reason, was no longer breathing. There was no circulation and no reflexes, no response. And that's how a declaration of death was done. It was pretty good. It wasn't absolute in the sense that there could be some errors, but it was pretty good. In fact of the matter is, it would seem to me that ought to be the standard. And if you're going to have a new way to declare somebody dead, it ought to be at least as good as the old way. If you're going to have some new way, it ought to get better, especially in a matter so important as life and death. Well, what happened was that in 1968, an article was published in the Journal of the American Medical Association entitled "A Definition of Irreversible Coma." That's the title. It doesn't say a new way to be declared dead. It says a definition of irreversible coma. Keep in mind, coma is kind of like the word comma. It's a pause. You can only be in coma when you're alive. When you're dead, you're not in coma. It doesn't make any difference what adjectives you put in front of it. A new way to declare somebody dead, and in that article, the Harvard criteria was published. And the Harvard criteria is amongst, at least a lot of people, said to be the most strict of all the criteria. I'm not sure that it is, but it's relatively strict. And it basically said that you had to be unconscious and on a ventilator and no reflexes, that I already told you about, that kind of thing. It did not require doing a brainwave test. Did not require doing that. A lot of people think that brain death means flat brainwaves. They don't even do it. They're not required to do it. Remember I said this one is considered to be relatively strict, but even this relatively strict one doesn't require it. They did say, though, if you did a brainwave test, then the brainwave test had to be flat, had to show no brainwaves. If you're going to have a new way to declare somebody dead, in medicine, we do testing. Is our standard way of making change. What kind of tests do? We do tests in the laboratory. We do tests on animals. We will do some what we call clinical trials. So it's a new way to declare somebody dead. Now, how many patients do you think they should test it on before it becomes accepted? Anybody want to venture a guess? How many? 50. That's not a bad number. Anybody else? To what? 50, she says. Sometimes when I ask an audience like this, I get 1,000. Some think about it, they say 10,000. That kind of thing. But 50 is not a bad number. That would be kind of reasonable, I suppose. I don't know. But so how many patients did they study before they published this criteria? Not 50. Not 10. No patients. You can look at the article. It's in the Journal of the American Medical Association. There's no patient data. There's no references to basic science studies. There's only one reference, and that's to Pope Pius XII. And they blame Pope Pius XII for a lot of things, but they put the onus of brain death on Pope Pius XII by saying, and what Pope Pius XII wrote, and you can look at it, it's an address to anesthesiologists in November 1957. And they quote him, and they say, Pius XII said, well, in these matters, we have to look for doctors, look to doctors for guidance. But 2 paragraphs later, what Pius XII said was that we are to presume that human life continues as long as vital functions are present, even when supported by artificial means. The teaching to me is pretty clear if you need that kind of a teaching. Now, I can tell you this much, that I found in the literature at least 5 places where that quotation of Pius XII has been misquoted. And they say, where he said, even when supported by artificial means, they changed it to unless supported by artificial means. And it completely changed the whole thing. The first time I saw it, I traced it back to 2 ministers in Indianapolis and talked to them and asked them where they got that quotation. And they told me they got it from the Euthanasia Society of England, is where they got that quotation. I was never able to find that exact publication where they have that, but I was able to find something very close to that. But it's in multiple places. Where did I find it out? Because a doctor gave an address to the bishops in Dallas, Texas, and the doctor who gave it misquoted Pius XII. And when I read this, I said, oh my, this is a problem. And so then I started to chase it down. I had my English translation, but I went to the original French. I found the original French article, and the French word is umame, O-U with a umlaut or slash or whatever it is, M-E-M-E. And I looked it up, and several French-English dictionaries and got French scholars and checked the whole thing out to make sure that I was correct. Then I went back to them at the John the 23rd Center and said, there's a problem here. The bishops have been presented something that's not accurate, not the truth. So they did change it in the written written document. So if you get a copy of it, it will be correct now. But that's not what was presented to the bishops, and so I just put that in there for whatever it's worth. But let's go on. 68, the first article. What happened in the United States? In less than, and why did this have to happen in 68? The reason it had to happen is because Christian Bernard did a heart transplant in 67, and then he did another one. And so if they were going to get hearts, they had to change the law. They couldn't be doing what they're doing without changing the law. So Kansas got involved, and by 1970 already had a statute, and then it moved quickly. By 1980, in the United States, the Uniform Determination of Death Act was supposed to be accepted. Brain-related criteria for death. What's a criteria? It's an observation used to make a judgment. There were more than 30 sets of criteria published by 1978. And the question is, and you need to know these questions, that if you get presented with a problem in some way, relative, whatever that is, if you're the patient, you won't be able to ask the question, but your relatives can. If this human being is determined to be dead, they come to you and say that your loved one is brain dead, then the question is, which set of criteria was used to make the determination? You got to ask that question. And then you got to go on and ask for the thing that makes those criteria valid. Well, let's just look at the criteria for just a little bit. The Harvard criteria was published without any patient data. The Minnesota criteria was published in 1971 and by Mohandas and Chu, and what was going on in Minnesota was that if they did brainwave testing, they found brainwaves, and then they couldn't get organs. So they set out to find a way to declare a death without requiring a brainwave test. And so what did they do? They did brainwave testing on 9 patients. 2 of the 9 still had brainwaves. Conclusion: no longer is it necessary to require brainwave testing. Now, is that based any kind of science? Dr. Wilkes, there's a great scientist, and is that any kind of science? No science. There's no science to that. How about the British criteria? They don't require brainwave testing. They finally wrote in the British Medical Journal, February the 14th, 1981, that the doctors in Great Britain were considerably influenced by the doctors in Minnesota who don't require brainwave testing, therefore they don't either. And that's how it was stricken from their criteria. The NIH criteria came out of the collaborative study, which is the largest study in the literature. Eventually they reported on about 500 patients, 503 to be exact. And what happened with the 503? The first thing is that 44 of them didn't die. That's the first thing. Of those who did die, they got permission to do autopsy on about half of them, 226 to be exact, and 10% had no evidence of pathology in the brain. So that when the pathologist looked at the brain, either under to look at it or under the light microscope, not electron microscopy, but under the light microscope, there was no pathology. They culled the data, did the very best they could with the data, reported it in the Journal of the American Medical Association in 1977, and that became known as the NIH criteria. And at the end of that article, there's a sentence that says this: these criteria are recommended for a larger clinical trial. You know, it's almost 25 years, and it's never occurred, and it never will occur. And why won't it occur? Because they already got everything they want. Not everything, but they already got a lot. More than 30 published criteria in the first 10 years. And every one's different. Every set of criteria is different. And every set of criteria, from the Harvard criteria on, tends to be less strict than the previous set. results in a more lenient standard for harvesting organs. They don't call that anymore. They call it recovering organs. It sounds so much better. There's no clearly determined parameters commonly held by the international scientific community. I put that language in there because the Pope had an address on this on August the 29th of last year. And in there, the Pope talks about clearly determined parameters commonly held by the international scientific community. There are no such things. So whoever was advising the Pope about that did not give him clear information. The brain dead, head trauma, infection, brain tumor, hemorrhage, cardiac arrest, injury plus oxygen leads to swelling, infarction of the brain means destruction of the brain. No matter how much there is, there's always some islands of sick but not totally destroyed brain cells. Somebody who's declared brain dead, they respond to surgical incisions when the organs are taken. One transplant surgeon told me that as they made the incision down the middle of the man's chest, he threw up both arms. These things happen. A chart that I have, a page in my room that I've looked at for a young man, 16 years old. He was accidentally shot in the head with a .22 caliber bullet. Anybody knows about bullets knows that that's pretty small, serious, but pretty small. In less than 4 hours, they declared him brain dead without doing any brainwave testing. His parents knew nothing about brain death, did like I suspect most parents would do. And the grieving, and they get told there's yes, this is a terrible thing. There's a way you can make something good out of this. Sign this organ donor card. They do that, or sign this permission. They do that, and then they went home. And 15 hours later, when they went to take his organs, what did they do to that guy? They gave him a general anesthetic. Can you imagine giving a general anesthetic to a corpse in a morgue or a funeral home? You know, and they don't always give a general anesthetic, but they did. Now, what do they do if they don't give a general anesthetic? They always give a paralyzing agent, something that blocks the nerves and the muscles. And there was a documentary put on by the BBC in 1980, and it's never been shown in the United States. I don't know if it's ever been shown in Australia. But the documentary is entitled, "Are the Donors Really Dead?" And in there, one of the British doctors was asked, "Well, why do you paralyze them?" And with his British accent, I'm not any good at imitating it because I don't have an accent. Just thought I'd tell you all that. In his British accent, he said, "Because the people in the operating room are uncomfortable if there's moving and squirming during the procedure." Yeah, that's why they paralyzed them. You know, should you know all this before now? Yes, you should. Why don't you know it? Why don't you know it? Because it's a big chore to get me to come down here, if you know what I mean. But everybody should be telling you this. All the doctors that participate in transplant surgery, they all know about this. They all know about it. As the transplant surgeon, this is my good wife Shirley, she has to listen to me all the time. I suggested her this morning, I said, maybe you ought to go listen to the man talk about creation. And she said, I don't want to go away from you. She said, besides that, I've heard it so often that if you can't talk or something, I can just fill in. The transplant surgeon in the debate said, yeah, I don't like that when that happens. Come on. What did he say was death? Unconscious and no brainstem reflexes. The brainstem is a very small part of the brain. And actually had several different definitions. I mean, it was shameful, is what I would say. He was a very nice man. I told him he was a very nice man. But I told him, even though you're a nice man, it won't be easy on you. And this was halfway in between the debate, and he said, you're right. But I was not as hard on him as I could have been. I could have really made him a fool. I could have really made him a fool, because somewhere in between there, he said they always wait, 3-4 days before this declaration of death. Well, it's an outright lie. Everybody knows that that's not the truth. And I could have really got him at that point, but I left him alone. Because there's enough people in the audience that know that if that guy is a liar about that, he's probably not telling the truth about a lot of other things. And an Italian peddler told me when I was a young boy about how do you deal with liars? And he said, you don't deal with them. You get away from them. Once you know you're dealing with a liar, get away from them. The responses and movements that are in the literature: spontaneous jerks of the limbs, decerebrate spasms, muscle tone is there, arms crossing over the chest and sitting up. It's called the Lazarus sign. That they do something to them, the arms cross over, they sit up. That happens. It's called the Lazarus. It's reported in the literature, but they ignore that. They choose to ignore that. Response to surgical incisions. Oh, I went backwards. Sorry about that. Okay. Pituitary functioning. Pituitary is the kind of the master gland that's in the brain. Depends on the brain for its functioning. Depending on which article you read, 22 to 100% of patients, that means all of them, depends on the study, determined to be brain dead, have been found to retain salt and water balance. Brain functioning persists even when there's herniation. That's where the brain herniates down into where the spinal cord would be, and no circulation. Even when it herniates, there's no circulation. There's still some functioning persist. And hypothalamic pituitary function, temperature control, blood pressure, and heart regulation. For the most part, these patients all have normal beating hearts. They have normal blood pressure. What happens if the brain truly does not have any kind of functioning so far as the blood pressure is concerned? Down. Certain brainstem reflexes, they don't check them all. The jaw jerk and snout reflex, they don't check those. They check about 5 of them. How many are there? I think at least about 15. Residual EEG activity, 20% or more of the patients have brainwave testing. I use this number because it comes right from Loyola University, a so-called Catholic medical school in the United States. Dr. Gregg reported that right out of there, but they choose to ignore that. Even though brainwave testing is positive, they go on to get the organs anyway. And the testing of the cerebrum, the largest part of the brain, and the cerebellum, it's clearly not adequate. I mean, so much of the brain is what we would call silent. We don't have good tests for it. We have some ways of evaluating the brain, but there's large parts of the brain that we still don't have any ways to test. The issues are, is the anencephalic infant dead? No. Are the donors really dead? No. What's the effect of the more lenient standard of death? It's the whole part of the culture of death. Brain death, whenever a state got a brain death law, what did they get after that? They got a living will law. They follow. One follows the other. The question is this human being dead? And if there is a genuine doubt of fact, when will we have the courage to speak for the defenseless, comatose patient? To say someone with a beating heart, a normal blood pressure, a normal color, and a normal temperature is dead is false. A person is living and not dead, even an instant before death. When there's still some doubt about death, excision of an unimpaired vital organ is prohibited. Pope John Paul II made that very clear. And then he went on to say, because the opposite is obvious, that if you would take an unimpaired vital organ before death, it would kill someone. And Pope John Paul II could not in any way support killing a person. To devise a fiction for the declaration of death is not ethically acceptable. And is morally wrong, and that's what brain death is a fiction. No unimpaired vital organ can morally be removed from a living human person. Pope John Paul said no commercialization of human organs, and yet this is $3 billion in live organs alone in the United States, and that was several years ago, was spent on that. Even even when someone's dead, the corpse is worth about $125,000 in the United States. People, especially the young, must fully comprehend, and Pope John Paul II made this very clear, must fully comprehend that about these things. Comprehend that agreeing to be an organ donor also means giving the transplant surgeons license to terminate their lives prematurely. Pope John Paul II didn't say it quite like that, but he said that it's important that we find out about these things. To remove a healthy, unpaired vital organ suitable for transplantation from someone declared legally brain dead but not truly biologically dead is not ethically acceptable. That is, evil may not be done that good can come of it. No matter what they tell you about the good that can come from this, you may not do the evil of killing someone. To cut out an unpaired vital organ, a heart or whole liver before death does not respect the dignity and value of the human person. The donor must be dead with complete certainty. That's what the Holy Father said, with complete certainty. Cessation of brain function laws followed by living will laws are all a part of or lead to a pivotal euthanasia. The Uniform Anatomical Gift Act is how they get these organs in the United States. The Uniform Determination of Death Act calls for irreversible cessation of all the functions of the entire brain. I would say those laws all should be repealed. Death ought not be declared unless the circulatory and respiratory systems and the entire brain have been destroyed. Now, some things about organ and tissue transplants, so we get that in perspective. A living donor can give one of a paired organ. A living donor can give one of two kidneys. That's morally acceptable. It's not without risk, but it can be morally acceptable. Certainly, to your brother or to your sister would not be. I don't think there would be any great question about that. One lobe of a liver and one lobe of a lung. In order to transplant an organ, it has to be a living organ. It has to be a healthy organ. Where do you get living organs? Where do you get healthy organs? From living persons. Now, after death, tissues can be taken and used for transplantation, but they're tissues. What kind of tissues? Skin, bones, cornea, veins, heart valves, and connective tissues. God made the cornea so it doesn't have blood vessels. If it had blood vessels, we wouldn't be able to see through it. God designed it so that the oxygen to our cornea comes from the environment, through the tears. And so the cornea can maintain its suitability for transplantation after there is no circulation and the like for a considerable period of time. So morally, we're not quite so concerned about that. Although a priest told me of a young man that was on a ventilator, and they wheeled him off, and he came back with patches on his eyes. The priest was very suspicious. Of course, he was telling me that sometime afterwards, and there was no way for me to investigate that. Now, how about those declared brain dead? That's where they get organs, from a declaration of brain dead. What's declared brain dead? That means you're still alive. If you were dead, they just call you dead. So you're still alive. Where you get heart, lungs, kidneys, liver, pancreas, and intestines. And then after all that, then they still take the tissues. And of course, you're dead after all that. No unpaired vital organ can come from a living person. You can't get a heart from a living person because you kill them. But yet, that's the only way to get a heart for transplantation. There's no hearts taken after death. No commercialization of organs and tissues. There's 63 federally approved organ procurement organizations in the United States. Mandatory notification of transplant center when death is imminent. By a decree of the Secretary of Health about 2 years ago in the United States, they made it mandatory that whenever a patient is in a hospital and death has occurred or death is imminent, they have to notify the transplant center. So they've got somebody that they use this word, death is imminent. They have to notify the transplant center. They have to send the records to the transplant center. And the transplant center determines suitability for transplantation. And if they determine that this patient has organs suitable for transplantation, then they come to the hospital to ask for permission from the relatives to get organs. No longer is the treating physician in the United States allowed to ask permission for the organs. It's taken away from the doctor. The heart, the body, like happens when death occurs, the surgeon stops it. Paralyzing drugs take away response of the donor. That's Joseph. Joseph was the little guy who started studying brain death. This is attachment to a ventilator. The ventilator is supporting his life. He's getting other things. Down here's an IV. He's getting other things. Joseph, remember what the transplant surgeon says, not for 4 days. Joseph was on a ventilator for 6 weeks. 6 weeks. He was on a ventilator for 6 weeks. We'd go in to see him in the morning. Of course, we were giving nutrition, doing all the things that we knew to do. We'd go to see him, and no matter what we did, Joseph would lay there and not respond. Wouldn't do anything. And so one of the residents said, well, let's do a brainwave test. I said, well, okay. So we did a brainwave test, and the report came back on his chart. It says, isoelectric EEG, consistent with cerebral death. That was what was on Joseph's chart. Well, I see this report. I know about Joseph. I say, in my simple little mind, say, what's this death word on his chart? It was in 1975. I knew nothing about brain death. What's this death word? So I say to the neurologist, I say, what do I do now? He said, well, wait a good length of time and get another one. I said, well, what's a good length of time? He said, 24 hours. So I said, okay. I waited 48 hours. Got another one. It was still flat. Report. Unchanged from the previous one. So I said to the neurologist, I said, what do I do now? And he said, well, in some places they turn off the ventilator. And I said, well, I don't do that. I said, I treat patients. I said, some live, some die, whatever it is. So I just kept treating them. And eventually, Joseph got off the ventilator. This is Joseph when he was 7. You're clapping for his guardian angel. That's who took care of him. His guardian angel took care of him. It'd been so easy to stop supporting his life. And maybe if I'd have been better educated, maybe I'd have done that. I don't know. But I didn't know anything about brain death. But eventually we got Joseph off the ventilator. Eventually went to school. He got straight A's. He ran track. He played baseball. Immediately I didn't ask for articles. But within a few months, I went to the neurologist and asked him for some articles about brain death. Because I knew about Joseph. And he said, oh, Paul, don't worry about it. It doesn't apply to infants and children. And in that time, he was correct. It did not apply to anybody under the age of 5. Now they go all the way down to within a week. But nobody under the age of 5. And of course, they kept narrowing that down over time from 5 to 3 to 1. And now they're down to within a week. They can find some way to declare this so they can get organs. But eventually he did give me some articles and I started studying it. It took me about 2 years before I understood about brain death, at least 2 years before I understood enough to say anything publicly or to write anything. And I'm still doing it. Now, I'll show you this just briefly, and we're going to have to quit so you have a chance to ask some questions. But this comes from Dr. Coimbra, and it points out, he's a neurophysiologist, and it points out 3 different kinds of patients. Patients who have a brain injury and they become dead quickly. Patients who have a brain injury and it takes a little bit longer till they become dead. And then patients who have a brain injury and have absence of functioning, but then they recover. Well, what he points out is that if you take these patients who have the chance of recovering and you do something called an apnea test, and all of the criteria call for apnea. What does apnea mean? It means without breathing, from the Greek. A, without, and it has to do with breathing. So without breathing. So keep in mind, folks, here's a patient who's on a ventilator, needs a ventilator to support his life. And along comes the doctor and takes off the ventilator. And they justify it on the basis that they're giving oxygen so there can't be further damage from the lack of oxygen. But breathing doesn't have to do with just getting oxygen in. It has to do with getting carbon dioxide out. So that when you can't get carbon dioxide out, what happens? The carbon dioxide goes up. When the carbon dioxide goes up, the pH goes down. When the pH goes down, that's acidosis, and that's bad for the body. That's bad. So somebody who's got an injury has to show that they can breathe on their own. This is awful. Absolutely awful. And every criteria calls for this. What Dr. Coimbra in his studies has been able to show that at least in animals and perhaps in patients also, is that if you cool them instead of doing the apnea test, then some of those who would otherwise die have a chance to recover. It's relatively new information, but it's exciting. But I'm going to stop there so that you can ask questions or make comments, because you're the ones that are important here.
One second. Sorry, Doctor. If you can just ask questions, not make statements, and if you can keep questions brief, we've got about 10 minutes for question time. And if I'd ask the doctor to just repeat them to the microphone. Thank you.
The lady to the right of you is first.
Doctor, I read the article on the paper last year in the Transplantation Society, and I did not read what you said. You actually condoned the concept of brain death and also transplantation as something one could do for another person.
Well, you better go read it again.
I have a copy. I've read it many times, and it's not what I read it to do, what the paper says about organ donation or transplantation.
All I encourage you to do is go read it again. I have to do things a lot like that, read things again to find out what they really say. And of course, the question to repeat it is that she says that she read what Pope John Paul II said, and she didn't get out of that what I said. But I can tell you this much, and I encourage you to read it again. There were a lot of people that, just hang on for a minute. There were a lot of people who got out of what Pope John Paul II said, that he said something in support of transplantation. And there were multiple articles published, and then it all stopped. When did it stop? It stopped in March. And the reason it stopped in March, and you can look in Catholic World Report for an article, and it's co-authored with two Catholic bishops, Bishop Bruskowitz and Bishop Massa, a cardiologist, a former transplant cardiologist, Dr. Nildis, a neurosurgeon, and Dr. Joseph Seifert, a philosopher from the Liechtenstein Institute, and myself. It's in the Catholic World Report, and you can go there and read it. And we took what the Holy Father said step by step and went through it. Who am I to say that we can do anything better than what the Holy Father said? But the Holy Father didn't suggest that the debate was resolved in any way. That's the first thing. The Holy Father said acknowledgement of the unique dignity of the human person has a further underlying consequence. Vital organs which occur singly in the body can be removed only after death. That is, from the body of someone who is certainly dead. That's what the Holy Father said. You know, that's a direct quote. Now, I would encourage you to read that and at least find that quote. Another one I told you about that the Holy Father called something like it seems that neurological criteria can be acceptable, and he said, but this, for this to occur, this consists in establishing. These are his words. Establishing, according to clearly determined parameters commonly held by the international scientific community. There are no such things. They don't exist. Now, I already told you, more than 30
That's your opinion, Doctor.
No, not an opinion.
No.
An opinion is something that someone can't come to any kind of a factual conclusion, and they lean one way or the other. It's not an opinion. It's a fact. It's a fact that more than 30 sets of criteria were published between 1968 and 1978. It's a fact that the largest study in the literature calls for further study. Those are facts. It's a fact that the Minnesota criteria and the British criteria do not require brainwave testing. These are facts. These are not opinions. That the criteria that are used in Australia, I suspect, are different than what's used in other places. So what the Holy Father was saying, those words, they don't exist. Now, and so what we said about that, it appears that the Pope has been misinformed about clearly determined parameters commonly held by the international scientific community. In fact, no such things exist. Now, these things are not a matter of opinion, but I will encourage you to read it again, read it, study it, take every word that makes you come to your conclusion, and then go look at Catholic World Report, March of 2001. And in there we go through, line by line, paragraph by paragraph, as to what the Holy Father said. And we are in support of what the Holy Father said. We say nothing against what the Holy Father said. We try to encourage people that at least that one little particular part. The other thing the Holy Father called for was irreversible cessation of all brain activity. None of the articles talk about activity. So it's a different word than function. He talked about something to me that is more minuscule. I think activity is more minuscule than a function. At least I think it is. You might think about it. But more minuscule. And then if you say, how can you have irreversible cessation of all brain activity? The only way that I know of at this time is to have no circulation. How can you have no circulation? No breathing, no heartbeat. That's the only way. And so if we follow the teachings of the Holy Father, what we have to at least conclude at this time, because there's no other way to determine this thing that he calls for, other than having no circulation. And so I would encourage you to read it. And a Catholic World Report, March, and keep in mind that as soon as the address was made, we started working on the article. If you get 6 people from different places and try to pull it together, it takes a little while. But then, it takes a little while to get the article published. You can't get anything published if you try. It's very difficult if you stand for the truth. This article that got published in Catholic World Report was sent to National Catholic Register. It was sent to The Wanderer. It was sent also to one of the other magazines, and I don't want to say the incorrect one, but I know about those other 2. None of them even acknowledged that we sent anything to them. Yeah, you can't get it published, even by what one might call conservative kind of publication, if you want to call it that. It goes on. It's that way. And I have lots and lots of examples of that. Now, there were letters to the editor. Let's assume that the people who read the article at least are able to read as much as you can. And I didn't see any letter to the editor from you, I don't think. Although we did get one letter from a lady in Australia. But letters to the editor, and they're published in May, and you can look at those. And they come from multiple places, and they were all in supporting the things that we said. There was only one letter that came to the journal that was in opposition to what we were saying, and that was from a Catholic priest, who's a very fine man, but he's been a proponent of brain death for many years. And so what happens is that, at least I think what happens, is that if you counsel, especially if you counsel someone to accept brain death, and it's very difficult to back up because for whatever reason they get concerned that maybe what they were saying wasn't correct, and I think that's what it is. I hope I answered your question, but I encourage you to go read again. Yes, ma'am.
Yes, are the smoking or tobacco lobbies responsible
Wait a minute, go slow. I'm sorry, what is it?
Are the smoking or the tobacco companies lobbies responsible for the great demand on heart and lung? Like, are they behind you, financially behind it?
She asked, are the smoking or tobacco companies behind the demand for hearts? Well, certainly smoking contributes to heart disease. There's no doubt about that. And insurance companies get blamed for a lot of different things. If I had to put pressure on anybody, I would put pressure on physicians. Why? Because at least I have license to put pressure on them. We're all in this culture of death. We're all in it together. And we have to try to stay away from the evil. But the things that I told you about the criteria and how they were developed, and in there I can show you some other articles that are supposed to be accepted, that's where the criteria are accepted. They use the same references that I use. Same references, same thing. And you can go look them up. I didn't make up anything. Anyway, I don't know if they're behind it or not. Yes, ma'am. Actually, she asked a very good question. If I understand her question, a patient got an operation on the brain, and 24 hours later was getting lots of life support, ventilator, insulin drip, and antibiotics, pressure monitor, lots of things that we do to support. And the pastoral care person pointed out they need to have relatives around. And certainly I would agree that it helps if you can't speak for yourself to have someone around you who loves you. That's very, very important. I find that the treatment of patients is different when someone is around who loves them. Then at least there is a chance that someone would come and ask permission to get organs or to turn off the ventilator or whatever that is. And what my advice has been to people who have called me in recent months about a loved one who's in an intensive care unit on a ventilator, and they say, Dr. Byrne, they want to turn the ventilator off on my father or my mother, whoever that is. Well, the advice I give in recent times is I say, you go back, you find that same doctor, that same person who said that. And I said, and you tell them that what you want is you want your father treated. You want your mother treated. You want them treated in the very best way that medicine knows how to treat them. You make that very clear. And then you say the next thing, since you brought up the subject of non-treatment, if anything happens to my mother, happens to my father, I hold you responsible. And every time I've done it, they come back to me and say, you know, Dr. Byrne, immediately things changed. And they started treatment in a different way. And so I don't know if that's the thing to do. It's the thing that I'm doing most recently. I don't know that it was an original thought, but I do know that it's been effective. Now, what happens to patients? What happens to patients if they don't get their organs because someone is hovering around and someone is paying attention? Well, they don't die. They don't all die. You can look in neurology. Alan Schumann has collected 178 what he calls chronically brain-dead patients. What happens, I told you about Joseph. That's one that I have personal experience with. I have personal experience with another one. Todd. Todd was 4 years old, had meningitis, and went into coma. I wasn't his treating doctor. He had very fine infectious disease people, pediatricians, neurologists, and they concluded that Todd was brain dead. And his mother said, treat him. And so they reevaluated after a while, and his mother said, treat him. And so since they knew I had interest in this kind of a case, they gave me the chance to go see him, which I did. And then several weeks later, when the treating doctor went out of town, he asked me if I would cover for him while he was gone. So I said yes. And so that I was covering for him. The nurse called and said, the blood pressure is going down on Todd. And just 9 o'clock at night, I said, well, okay, he's been declared brain dead. These things happen. So I waited a little while and then went over to the hospital. So his blood pressure was lower then when I went over than it was what the nurse said. And so I said to his mother, I said, Renee, Todd's blood pressure is going down. I said, that's not a very good finding. And I said, now, some people would give medicine to get the blood pressure up. And Todd was there in an infant or child's bed, sides on it, like a crib, and Todd's mother was sitting next to him, and I was standing up, and I'll never forget this. And she looked up at me and said, "You mean there's some medicine that you can give to get his blood pressure up?" And I said, "Yes." And she said, "Well, get on with it." I'll never forget it. Todd's still alive. Todd isn't 4 anymore. He's got to be at least 20. Not too long ago, I went to see him. He lives at home. His mother takes care of him. He's not a little 4-year-old boy anymore. He's a big grown-up person. He's still on a ventilator. I asked his mother, "How are things going?" She said, "Fine, now that I got him home." I said, "Are there any problems?" She said, "Would take care of him." She said, "No problem, except he's had a kidney stone a couple of times." And she said when he passes that, he has a lot of discomfort, and so that causes problems. And twice I've told this situation. One was at a leading Catholic bioethical institution in the United States, and one of the people said, "I would turn off his ventilator." He never saw him. That was in a state far away from Omaha, Nebraska, where Todd is. And then with the transplant surgeon, that I debated recently, he more or less said the same thing. They never have seen them. And both times in my mind, I said, "Over Renee's dead body, you turn off the ventilator." That's her son. I've dealt with patients sometimes, and I can remember another one, the little baby who had a brain tumor. The tumor grew so much, the soft spots, the tumor grew out of the suture split, and we tell the mother how sick her baby was, and she would stay there that day, go home, come back the next day, and we would tell her again how sick, and it was just like she never heard us, every day, and of course the world says that's denial. But I kept on and with taking care of. Eventually, this little baby died. So then I said to her, "Tell me, what was going on?" Every day we would tell you how sick your baby was, and every day you would come back and it was just like you never heard us. What was going on? She said, "Dr. Byrne," she said, "I had faith that God could heal my child. I had hope that God could heal my child, and I loved my child." That's the Christian approach. When somebody is very sick, you don't say, "Well, we don't know what to do," or we don't apply words like irreversible, which is a word that's not really correct. If you want to use a word like it, irremediable is a more correct word. We don't know how to correct it or whatever that is. But we still never kill, and we never harm. And what do we do as doctors and nurses and caring people? We protect life, preserve life, prolong life, and postpone death, but we never kill, and we try never to do harm to a patient. Thank you very much.